my name is Sarah, and we're going to be doing the nasogastric tube insertion today. So I'm going to walk into the room, provide privacy.
I'm going to go ahead and hook up my suction.
I'm going to explain, check the patient's name and date of birth, check the order, then make sure that my patient is conscious, and then I'm going to assess the nasal cavity. Ask them if they've had any history of allergies or if they've ever had an NG tube before. In this case, she said no. Then going to perform an abdominal assessment and see if I hear any bowel sounds because that can affect the tubing. So then I'm going to raise the bed up and explain the procedure. So I'm just going to put this tube in your nose, and it's going to go down to your stomach, and it's going to kind of release some of the pain and pressure in there. Okay. So I'm going to give them a tissue so they can blow their nose. And then get a towel. This is just in case they start to vomit. I'm also going to give them a emesis basin in case she starts to vomit. So if you start to vomit, you can go ahead and vomit into here. We're going to leave the tubing in place just so we don't have to do it, redo it again and put you through that again. Okay? So then I'm going to set them up in high Fowler's position. I'm going to prepare all of my stuff over here. So I'm going to put lubricating jelly on here so it's ready.
Go ahead and untape.
Okay. Now when I take this out of the package, it's going to be kind of stiff, so I'm going to go ahead and coil that so it's good to go. And then I'm going to measure it to see how far I can go. So I'm going to go from the tip of the nose, around the back of the ear, and down to the xiphoid process. So that's going to be right at about 55. So I'm going to tear a small piece of tape.
Well, the tape's not coming off.
I'm going to tear a small piece of tape at 55 and mark it so I know where to stop when I'm inserting the tube. Now I've asked her, I've assessed her, I've explained the procedure.
Try to take all the tape
so we're going to go ahead and get started.
So
I'm going to go ahead and drag this.
Make sure this is underneath.
Oh, I'm going to perform hand hygiene and put on my gloves.
So to take a deep breath in and hold it. And I'll just go ahead and hold up into the
I also performed hand hygiene before I entered the room.
And then I would just kind of keep the patient.
So I have my tube. I'm going to go ahead and drag it and rotate it through the lubricating jelly. Make sure it's going to be good to go. Okay. I'm going to have you put your head back for just a minute. And then Erin here is going to give you some water, and I'm going to encourage you to keep swallowing as we do this. You might feel a little bit of discomfort, a little bit of pain. It might burn in the nasal cavity a little bit, but ultimately it's going to make you feel better. So she's going to put her head back. I assessed earlier, and the right nair was bigger and didn't have any lesions.
Here, we can all use this.
Okay, now put your head down and begin sipping water. Okay, keep swallowing, keep swallowing. Okay. I have now attached it, or inserted it into the tape. I'm going to take this syringe, attach it to the end, and aspirate to make sure that it's in the stomach instead of in the lungs, and then I'm going to test the pH of this. Now I'm going to tape it to secure it. I'm going to rip 2 pieces of tape.
You're all good.
Okay. Put 1 piece of tape right here. It's going to wrap around. A little bit lower. and then wrap around. And I'm going to fold the edges so it's easy to undo. And then my next piece of tape I'm just going to put right over the bridge of the nose, which I cleaned before this whole process. So just like that. Now I'm going to set it up with suction. So I put this end on here to relieve any gas that's in there. Over here, I've set up this tubing. I put it on low intermittent suction, this tubing, and I've checked all the tubing for any holes or leaks or problems. Okay. And then I'm going to attach this end to my patient. And then before I set her up for suction, she's going to go to X-ray and make sure that it's in the correct place.